learn about a small demonstration. Okay. Before we begin, I just want to ask you a small question. Okay. So, whom do we seek when we are not well? Doctor. Okay. And who will ask you to stay strong and healthy? Doctor. Exactly. So we do have two special guests from Apollo Hospitals. One is Dr. Srinivas sir, who is the head of the department from Emergency and Critical Care from Apollo Hospitals, and Dr. Vakil sir, a pediatrician from Apollo Hospitals. So please welcome. Children, these two doctors are here to teach us a small demo on life-saving skill, which is very important for us to learn, for every one of us. Okay? And I hope you listen very carefully and see the demonstration well. Okay? Sir, please.
So I am Dr. Srinivas. As Madam told, I am a consultant in emergency and critical care. Who are in life-threatening conditions, who are in life-threatening illness, okay, those people only will get things. Whoever presents to emergency, a situation, any injury or illness that poses a threat to his or life. So, whenever a person is having a threat to his life or her life, then they will come to hospital. Which department? It is emergency department. And whoever is critically ill state will be treated in hospital in a unit called critical care (ICU). Okay, so we will be dealing both emergency and ICU. And our society is Indian Society of Critical Care Medicine, where we have around 18,000 doctors, professionals who are in this society, and we took an initiative to teach school CPR to create an awareness among you all people, because you are all very kids who can, when you put a seed, will be exploring. So awareness of CPR will be explored. And whenever there is a person who suddenly becomes unconscious in front of you, okay, in front of you, when the person is not able to breathe or when he is not responding, you will think that person is in cardiac arrest. Means heart gets stopped. Okay, heart gets stopped, then we'll assume that the person is in cardiac arrest. In India, outside the hospital, 50% of the individuals get the cardiac arrest like this, and by the time they reach the hospital, they lose life. Okay, so in abroad countries, this CPR awareness is around 40 to 60%, but in India it is only about 10%. Only 10%. And by the time they reach the hospital, around 50 to 60% will die. Only 30 to 40% will survive, but they will be unconscious, comatose condition. So when you start CPR at the earliest, after screen slide, there is chance of survival. So the outcomes will be increased by 2 or 3 times more than if there is no CPR. So our society initiative is to create an awareness, to learn CPR can save a difference. 2 hands can save a life. That's the main motto of this school CPR program. And here we are teaching you only about compressions. We are teaching only about chest compressions. How to do chest compressions. Okay? I will tell you when we have to do this also. As in the slides you can see when to do this CPR. Okay? Understand? So, and in India also, by the time ambulance reaches also around 8 to 10 minutes. Usually, ambulance should reach within 8 to 10 minutes. But in India, because of our traffic sense and roads proper, there are no roads properly, then the time of reaching to that scene will increase by around 50 to 30 minutes. So this cardiac arrest, when a person is in cardiac arrest, immediate CPR within 3 to 5 minutes, you start doing chest compression. There is the chance of survival. Okay. This is the main aim. Actually, in 2019, this Minister of School Education has told that the school CPR will be incorporated in the 10th class syllabus itself as a first aid and CPR. But it didn't happen because of COVID and all those things. So that also made our society take an initiative to collect all the signatures from the students and teachers and send to the government and make it a compulsion of this syllabus, first aid and school CPR as a 10th class. That's also our. It's a non-profitable association. Only around 18,000 intensives in our society. Every Tuesday, we conduct this program in schools nearby, in and nearby neighborhood. This is our 14th session. Okay, this is in NELLORE itself. And from my society, myself, Dr. Rafi, all will be, and other hospital doctors, not only Apollo. Whoever is in emergency and critical care departments, they teach these schools. So this is the gist which I was telling. 80% of the cardiac arrest occurs outside the hospital, largely at home, and bystander CPR means at the side. Whoever witnesses the cardiac arrest. Cardiac arrest means no response, no breathing. Then we understand that person is in cardiac arrest. Okay. So that percentage of persons doing CPR is also around 1 to 10%, and average ambulance response time is 50 to 30 minutes. And personnel who are in this ambulance also, they don't know about CPR. Only 12.5% of the people who are in ambulance only know. All these things makes us that there is an importance of community CPR awareness, means bystander CPR. That's why we are here to teach you compressions only life support. In saving a victim, saving a person, there are 3 levels. One is compression only life support. Second is basic life support. Third is advanced cardiac life support. BLS is given by healthcare workers, ACLS by healthcare workers and doctors when they come to hospital. But what we are teaching today is only compressions only life support. We are not teaching about breathing. Only we are telling you how to compress. Okay? They are just compress. So whatever in our air also, whatever we take to inspire, there is 21% oxygen. So this oxygen, when we inhale or when we take, it goes into the lungs. From the lungs, it reaches the circulation. So from the right side of the heart, the blood goes through the lungs. When it goes through the lungs, it takes the oxygen and reaches the left side of the heart. From the left side of the heart, the blood is pumped into various important organs like liver, kidneys, brain, everywhere the blood is pumped into the circulation and reaches the important vital organs. In that blood, oxygen is dissolved. So oxygen is blood is the carrier of the oxygen. If there is no reaching of the blood to the main organs, there is no supply of oxygen also. If there is no supply of oxygen, the cells will die. Cells will die and tissues will not function and organ will go into dysfunction and go to death. So that's why we tell oxygen is the important delivery which is delivered by the blood. So the heart should squeeze the blood out into the circulation. Okay. Normally 72 times heart will beat. 72 to 80 times heart will beat. But when suddenly it stops, when suddenly heart pumping is stopped, there is circulation of blood into the very vital organs. So there is no blood supply, there is no oxygen supply. There is no oxygen supply, again cells will die and ultimately person also will go into death. Okay. Yeah, that's why importance of the heart to squeeze the blood into the circulation. That can be only done by when normally heart is beating. If heart is not beating, then we have to do chest compressions. We have to do the center of the chest. Below this sternum, this is called breastbone. This is called breastbone or sternum. These are ribs. So here, beneath this breastbone, that is compress this chest so that heart will be squeezed and the blood will be pumped out of the. So when you do compressions like this, the heart gets squeezing of the blood into the circulation. So you have to do chest compressions. Okay, like this. If you do only heart, the blood will be going into the circulation. So when heart suddenly stops, then we will do manual chest compressions. Okay. So in this diagram, you can see the importance of chest compression. When you do chest compression, the oxygenated blood from the arteries reaches.
Our heart is an amazing organ. It works hard for us every second of every day, delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any intervention, the brain, vital organs, and our heart.
There is no circulation of these arteries. No arteries are oxygenated. It will not reach the brain when heart is not beating.
Will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1. Compressions move oxygenated blood to the brain to keep the brain alive. And 2. Compressions keep blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood, therefore not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood, therefore no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can, and don't give up until medical help arrives or an AED is present. You can do it.
See? All of you do hands like this. Straight. Arms straight. Elbows fixed. Arms straight. Elbows fixed. Okay? One hand over the other. One hand over the other. Okay? And interlacing of the fingers like this. Like this. Okay? Arms straight. Elbows fixed. It should not be like this. Okay? Arms straight. Elbows fixed. One hand over the other. One hand over the other. Only heel of the palm. Only heel of the palm over the center of the chest. Okay, here the center of the chest. Center of the chest. How to follow this? Through the rib cage. Here. Like this rib cage is there. Up to center you have to come. Then up to center. Here you have to keep 2 fingers like this. 2 fingers. Then one hand another hand, one hand over the other, arms straight, elbows fixed. Okay, clear? So these are CPR hands means two hands, arms straight, elbows fixed, interlacing of the fingers. Interlacing of the fingers, only heel of the palm, only heel of the palm over the center of the chest. Then you should start doing chest compression. Push hard, push fast. 100 to 120 compressions per minute. And you are pushing hard and fast should be only 2 inches step. You should not do like this. Okay? Then there is a chance of the bone, the ribs gets fractured, and sometimes it is an ineffective CPR. So, for effective CPR, push hard, push fast. Push hard, push fast. Okay? Allow the means you should be like a sir, put your complete weight like this. Complete weight. See, this is only just I'm just creating a awareness, putting a seed. You can go through many YouTube channels, Google, many channels, many videos will be there. But my job is to just create an awareness. Okay? And practice it when necessary. When it is necessary, we don't know. Anytime a person can become unresponsive and no breathing difficulty. Okay, clear? Clear. Just stay awareness. Just stay awareness. Okay, don't go and then jump on being all persons. Clear? I am afraid also. That's why I am asking you who is 10th class, who is 10th class. Okay? I am afraid. By teaching you also, I am afraid actually. But please understand, this is only an awareness, just putting a seed in your brain, so that you will explore more about cardiac arrest. Cardiac arrest. Heart attack mere, cardiac arrest mere. Chest pain వచ్చినోళ్ళందరూ మీద చేయకూడదు. ఓకే, క్లియర్? గుండె నొప్పి వచ్చిన వాళ్ళ మీదంతా చేయకూడదు. ఎవరైతే స్పృహ తప్పిపోతారో, ఎవరైతే గాలి పీల్చుకోవడం లేకుండా ఉంటారో, తట్టినా పలకపోతే, కళ్ళు తెరవకపోతే అట్లాంటి వాళ్ళకి ఈ సిపిఆర్ అనేది చేస్తాం. కానీ దానికన్నా ముందు ఏం చేయాలి? 108 ఫోన్ చేయడం వెరీ వెరీ ఇంపార్టెంట్. అది స్టెప్స్ లో చెప్తాను నేను. ఫస్ట్ ఇది చెస్ట్ కంప్రెషన్స్. ఓకే, ఓన్లీ అబౌట్ హౌ టు గివ్ చెస్ట్ కంప్రెషన్. హ్యాండ్ స్ట్రైట్, ఆర్మ్ స్ట్రైట్, ఎల్బోస్ ఫిక్స్డ్, ఇంటర్లేసింగ్ ఆఫ్ ఫింగర్స్, ఓన్లీ హీల్ ఆఫ్ ది పామ్. ఇట్లా ఎంటైర్ గా పెట్టకూడదు, టోటల్ పామ్ ని పెట్టకూడదు. ఓన్లీ హీల్ ఆఫ్ ది palm over the center of the chest. 100 to 120 compressions per minute. But to tell 100 to 120 is very difficult. So what our class tells is, our guidelines tells is, compressions only, life support. This is only compressions, only life support. I am not teaching you about breathing. Okay, because it is a public CPR. We cannot give mouth to mouth breathing for every individual. Okay, to our own people we can give mouth to mouth breathing. But in the community, we will not teach about breathing, only about chest compressions. Compressions, only life support. Okay, clear? So here what we do in compressions only life support is, we tell 120 is very difficult for us to remember. 100 like this, 1, 2, 3. 30, 30, 30, 30, 5 sets chest. 30, 30, like this. See again. 1, 2, 3, 4, 5, 6 plus chest start. 26, 27, 28, 29, 30. కొంచెం చేయలేదు మొత్తం లేపేది కొంచెం బయట మళ్ళా 1, 2, 3, 4, 5, 6, 7, 8, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6 ఇట్లా 5 sets. 5 sets. Every day after doing 5 sets, we should see whether he can functions are remaining. Okay, clear? This is chest compression. Now let's go to steps. How to do this? How to go for CPR. So I told you only now technique of CPR. I have not told you steps of CPR. Okay, clear? So now see here, these are the steps in compressions only right. A person or your most person is in front of you, walking in front of you like this. Okay, assume. Okay, clear? Assume is walking in front of you. Okay, your known uncle, auntie, or someone on the road also. You are walking like this. Suddenly in front of you, he collapses. He collapses. And you have witnessed the collapse. You have witnessed the collapse. So immediately you should not go and check the responsibility. Here he has fallen in front of you. You have witnessed, you have seen a person who got collapsed in front of you. So the first step is you recognize that he has collapsed. Okay. Second step is scene safety. When you are going, suppose in the middle of the road, you cannot directly go and help him. Because sometimes the traffic, another vehicle may hit you. Or suppose he has fallen near a transformer, there will be a shock to you also. So our safety is first. Rescuer scene safety. My safety is first. Then I am going to help others. My safety is first. That is called scene safety. Suppose there is a snake. Snake has bitten a person and snake is still there. You cannot go and try to help him. Or there is some fire is there. You cannot directly go and help him. So our safety is first important. So scene safety is important. So for again, a person in front of you suddenly collapsed. You have gone near to him and when you have checked the scene is safe. I am safe. I am safe. There is no traffic. There is no vehicle. There is no electric wire or there is no any animal, there is no any fire. I am going near to him and checking the response. Okay, third step, check the response. Okay, I am going here, checking the response. See, checking. Are you okay? Are you okay? Like this. First thing is talk. Uncle, then touch. Then tap. Like this. Uncle, if uncle is not responding, or there is no chest raise, then you have to say cardiac arrest. Say cardiac arrest. Cardiac arrest is heart is stopped. Heart attack is chest pain. Okay? Here cardiac arrest. Heart is stopped. So that's why he is not responding and he is not talking. He is not opening eyes. He is not coughing. Then there is no signs of life. If he is able to talk to you, if he is able to open eyes and doing some sounds, making some sounds, then it means there is life is still present. He is not opening eyes, he is not responding, then there is no signs of life. Then immediately you have to call for help. That is phonetic ambulance. Okay? Or any uncle is going in, you ask him, uncle please call ambulance, call 108 ambulance or call 1066, something, whichever you know. And until the ambulance comes, what is the next step that we have to do? Sometimes, by the time the ambulance comes, this uncle can get up also. He will open eyes, he will talk. You have to put a questionnaire. COWS. C means, can you hear me? O means, open your eyes. W means, what's your name? S means, squeeze my hands. Okay, so uncle suddenly ambulance నుంచి లోపల అంకుల్ కళ్ళు తెచ్చేసి అంకుల్ కెన్ యూ హియర్ మీ అంకుల్ వినబడుతుందా కళ్ళు తెరవండి మీ పేరేంటి చేతులు పట్టుకోండి దట్ ఈస్ వాట్ వి ఆస్క్ యూజువల్లీ కౌస్ సి ఫర్ కెన్ యూ హియర్ మీ ఓ ఫర్ ఓపెన్ యువర్ ఐస్ డబ్ల్యూ ఫర్ వాట్స్ యువర్ నేమ్ ఎస్ ఫర్ స్క్వీజ్ మై ఓకే దట్ ఈస్ ఇఫ్ అంకుల్ ఇస్ రెస్పాండింగ్ విత్ దట్ క్వశ్చన్ దెన్ he is fine. Okay, if he is not responding or he is responding but not fully oriented or not fully active, then also you can make him to turn left side. Take it to turn left side until ambulance comes. Until ambulance comes. But you have found that this uncle is not responding, not able to see the chest rising, then you have to assume that person is in cardiac arrest and then start doing CPR. Okay, this is only awareness, just a thought. You don't need to do, or you can basically you should call for it. When you grow up, when you feel that I can do CPR, then you do it, no problem. Okay, some CPR is better than no CPR at that moment. 3 to 4 minutes of life. If you do CPR, you can save a life. There are many stories. As a doctor in emergency, I know దట్ పర్సన్స్ టెలింగ్ ఇంట్లో పడిపోయాడు సార్, వెంటనే సిపిఆర్ చేశాం సార్, ఆయన కళ్ళు తెరిచేసారు సార్, తీసుకొచ్చాం. కొంతమంది స్టార్ట్ చేసి సిపిఆర్ స్టార్ట్ చేసి వాళ్ళు కాన్షియస్ గా ఫుల్ గా రాకపోయినా హార్ట్ బీట్ అయితే ఉంటుంది. అట్లా there are many stories which I can say. A tenant doing CPR for a house owner, and house owner by the time he came to the hospital, though he is unconscious, but heart is beating. Within next 1 or 2 days, he became fully conscious. He became a life savior. Became a life savior to that person. Okay, we don't know when it is. It can come anytime. Cardiac arrest can happen anytime, anywhere. Once you after this class, maybe in your 12th class or when you are doing some degrees or graduated, this small seed of this awareness of CPR can make you to attempt CPR when there is a need. Maybe when you are flying in the plane or when you are going to some train, bus, malls or in cinemas, wherever, sometimes some person in front of you becomes in a unconscious state or collapses. That time you may remember this class. That's our main idea or interest in creating awareness of school safety. Okay, so the first step is you have witnessed a person collapsed in front of you. Second step is you identify my scene is safe. I am safe to go near to the person. Third thing, you have checked the responsiveness of a person. He is not responding immediately. You have called for help or called EMS. And then till the ambulance came, you did wait as a bystander. You attempted a CPR because there is no response, there is no breathing. He is not responding and his chest is not raising. So you have attempted thinking that he had gone into cardiac arrest, and sometimes you start doing CPR. Suddenly you may walk like, hey, and it could have but that time you have to stop. Became conscious, some signs of life, like he is able to talk, he is able to moan, he is able to cough, or he is opening eyes. Then there is a life. So don't need to do CPR. CPR is done only when there is no signs of life, when there is no signs of life. Added to this, compression only lies about. What we have told is only compressions. Okay? But our own person, our own parent or our own friend, our own relative sometimes collapses like this. Added to doing this chest compression, you can also give breathing. You can also give breathing by closing the nostrils, opening the mouth, take a deep breath, give mouth to mouth. Okay, to our own person, our own parent, our own friend, our own relative. When you know him, you can attempt breathing also. But my class is limited only to compressions only life support. If I give breathing, it becomes basic life support. Okay, if I give injections, it becomes advanced cardiac life support. So 3 levels are there. We are teaching you only compressions only life support. Compressions only life support. Until you get the help, you should go on doing chest compression. Like at least you can give for 20 minutes. So by that time, definitely a medical help will come near to you. Okay, clear? So again, I will repeat with my last thing. First step is recognizing the victim has collapsed in front of you. Second thing is scene safe. Third thing is checking for the response. If no response, call for help until the help comes. If person is not responding or not breathing, then you are going to do CPR. Cardiopulmonary resuscitation. Cardio means heart. Pulmonary means lungs. Heart should squeeze the blood, and that blood should contain oxygen that is coming from lungs. And why there is importance of this CPR within 4 to 5 minutes is brain, if you don't give blood supply within 4 to 5 minutes, the brain will not come back to routine, normal. It goes into irreversible condition, irreversible brain injury. That's why many times whenever we do a CPR also, patient will remain in అన్కాన్షియస్ స్టేట్, కోమాలో ఉన్నారు కానీ వెంటిలేటర్ మీద ఉన్నారు, బయటికి రావాలి. బాగుంటుంది, అన్నీ బాగుంటాయి, కానీ పర్సన్ మాత్రం కాన్షియస్కి రీగైన్ అవ్వాలి. ఎందుకు? ఆ 4-5 minutes ఆ టైం లాస్. సో ద టైం లాస్ ఈస్ లైఫ్ లాస్. Time loss is life loss. So that's why the CPR should be initiated immediately, as soon as possible. But attempting this community CPR will make this 3 to 4 minutes or 5 minutes to regain the life. Learn CPR, save a life. Your 2 hands can save a life, and it will make a difference to one's life. Okay, thank you. I'll just end with my one video. Then we'll do a practical session, hands-on practice. But please understand, this is not a joke. Don't practice on anyone. Okay, don't be a playful and do all those things. My sincere thing. Only just your awareness. Once you become grown up, this awareness will make you to explore to do all this CPR techniques, and it may save a life, and you may become a savior. Okay.
ఈ వీడియో చూసి సిపిఆర్ గురించిన ముఖ్యమైన విషయాలు తెలుసుకోబోతున్నందుకు అభినందనలు. గుండె సంబంధిత వ్యాధులు మన దేశంలో అత్యధిక మరణాలకు ప్రధాన కారణం. గుండె సంబంధిత వ్యాధుల గురించి మరింతగా తెలుసుకోవడం, వాటిని నిరోధించడం మరియు బాధితులను ఆదుకునే విధానాలపై అవగాహన పెంచుకోవడం వలన మీరు మీ స్నేహితుల మరియు కుటుంబ సభ్యుల ప్రాణాలను కాపాడగలరు. ఈ శిక్షణను మీరు పొందటమే కాకుండా మీ బంధుమిత్రులకు కూడా ఈ శిక్షణ అందించడం వలన ఎన్నో ప్రాణాలను కాపాడిన వారు ఉంటారు. ఎందరికో ఆపద్బాంధవులు ఉంటారు. ఇట్లు డాక్టర్ లోకేష్ ఈదర మరియు డాక్టర్ విష్ణు కలిదేని.
ఎవరైనా కుప్పకూలి పడిపోతే ఏం చేయాలి? ముందు పరిసరాలు శ్రేయస్కరమా అని గమనించండి. పడిపోయిన వ్యక్తి 2 భుజాలపై చేతులతో తట్టి ఆ వ్యక్తిని బిగ్గరగా పిలవండి. శ్వాస తీసుకుంటున్నారో లేదో నిర్ధారించండి. ఆ వ్యక్తి స్పందించకపోయినా, శ్వాస తీసుకోకపోయినా చుట్టుపక్కల వారిని సహాయం కోసం పిలవండి. తక్షణమే అంబులెన్స్ కొరకు 108కు ఫోన్ చేయండి. ఛాతిపై ఒత్తిడి కలిగించడం ప్రారంభించండి. ఒక చేతిని ఛాతి మధ్య భాగంలో పెట్టండి. 2 వేళ్ళని ఛాతి ఎముక క్రింద భాగం పైన పెట్టండి. మరో చేతిని ఈ చేతి పైన పెట్టి వేళ్ళలో తాళం బిగించండి. మోచేతులు నిటారుగా పెట్టి భుజాలు ఛాతి పైన ఉంచండి. 5 నుండి 6 సెంటీమీటర్లు గట్టిగా క్రిందకు ఒత్తండి. ఇలా నిమిషానికి 120 సార్లు చొప్పున చేయండి. ఒత్తిడి చేసిన ప్రతిసారి ఛాతిని పునఃస్థితికి రానివ్వండి. 1 నుండి 30 దాకా బిగ్గరగా అరుస్తూ లెక్క పెట్టండి. 30 చొప్పున 5 సార్లు ఛాతిపై ఒత్తిడి చేసిన తర్వాత ఆ వ్యక్తి కదలడం, దగ్గడం, మాట్లాడటం లేదా శ్వాస తీసుకోవడం వంటి స్పందన కోసం గమనించండి. ఆ కారణంగా ఛాతిపై ఒత్తిడి చేసే ప్రక్రియను ఆపకండి. కుప్పకూలిన వ్యక్తి స్పందించే వరకు లేదా సహాయం అందే వరకు ఈ ప్రక్రియను కొనసాగించండి. వెనకడుగు వేయకండి. మీ చర్య ఒక నిండు ప్రాణాన్ని కాపాడవచ్చు.
Thank you. For each mannequin, 6 people please assemble. Okay, six people, 6 students please assemble around the mannequin. So this is the video where this community CPR has helped to save a life. I think this you can see on YouTube also. Came to jewelry shop, suddenly collapsed. The shop owner recognized that he has gone into cardiac arrest. The real thing. Okay, CC camera. It is recorded in CC camera. So he made scene clear. He has not attempted CPR on the chair. Just made him lie down and then started doing CPR. You should not give water or put some clothes or heating, all those things. waiting for ambulance. Ambulance didn't come so far. So he started doing CPR. He is trying to give some tablets, solid tablets. That is also not needed. Okay? Should not do pouring water. You should not do it. CPR, only the compression. He suddenly started moving. He's telling, stop. He started moving, stop. Another person is telling. Again he became unconscious. Now he's telling he's okay now. Person is telling, I'm okay. Again he's not responding. Again he started. Now he's fully awake. Okay? You don't know when it is needed. Okay? Just keep as a seating your brain. It can be done anytime, anywhere, in any situation. Okay, thank you. Cessation of the blood flow to the heart. Means sudden stop. That is cardiac. Heart attack is chest pain. Narrowing of the vessels.
Sir, if we don't have that much time to count, we can up to the first time wake up we can do CPR.
No need to. You can do up to whatever time you can do until you become fatigue.
Means up to the person wake up we can do the up to that much time CPR. Or we must do counting, sir.
No. Up to 20 minutes you can do. But counting is for our chest compression. Every time 30 compressions. 30 compressions. Okay, one set 30 compression. Second set 30 compression. Third set 30 compression. Fourth set 30 compression. Fifth set 30 compression. Again you have to check. Because in doctors will check pulse. Doctors will check pulse. But for you it is only checking the response. It's not responding. Again 5 sets. Again check. Again 5 sets. Usually by 15 to 20 minutes we will become fatigued. So by that time usually the ambulance will and automated AED. See for that very nicely as airport lo ఇట్లా చెన్నై ఎయిర్పోర్ట్ అంతా ఉంటుంది, పెద్ద మాల్స్ దుబాయ్ ఎయిర్పోర్ట్ పోతే ఉంటుంది. పేరు ఆటోమేటెడ్ ఎక్స్టర్నల్ డిఫిబ్రిలేటర్. ఆటోమేటెడ్ ఎక్స్టర్నల్ డిఫిబ్రిలేటర్. ఇప్పుడు నేను చెప్తున్నాను కదా, ఈ స్పీకర్ నేను చేస్తూ ఉంటాను, ఇలా చేస్తూ ఉన్నాను, 30 కంప్రెషన్స్ చేస్తూ ఉన్నాను. కానీ కొన్నిసార్లు హార్ట్ అటాక్, ఈ కార్డియాక్ అరెస్ట్ అనేది రిథమ్ డిస్టర్బెన్సెస్ వల్ల కూడా, అంటే హార్ట్ బీట్ రెగ్యులర్ గా లేకపోతే ఇర్రెగ్యులర్ గా ఉండి సడన్ గా స్టాప్ అయింది. అప్పుడు నేను ఇది చేస్తా ఉన్నాను, కానీ రిథమ్ మళ్ళీ రీస్టోర్ చేయడానికి నేను జస్ట్ కంప్రెషన్స్ చేస్తా ఉన్నాను. ఓకే, 100 కంప్రెషన్స్, 100 to 120 కంప్రెషన్స్. నా తోటి ఎవరైనా ఉన్నారు, సపోజ్ మీలోనే ఒకరు ఎవరైనా అనుకో, గోన్ మన సీరియల్స్ అంతా ఈ మధ్య వస్తుంది, హౌస్ అని, కొన్ని నెట్ఫ్లిక్స్ లో అంతా సీరియల్స్ ఉంటుంది, డాక్టర్స్ సీరియల్స్, దాంట్లో కొన్ని ఈవెంట్స్ చెప్తా ఉంటాం, గో గెట్ ఏఈడి అంటారు. గో గెట్ ఏఈడి అంటే ఇది ఎక్స్టర్నల్. ఇదేంటంటే ఇది అన్ని చెప్తుంది అనమాట. ఈ మిషన్ తీసుకురావాలి. మనకి మాల్స్ లో అంతా ఫైర్ ఎక్స్టింగ్విషర్స్ ఉంటాయి కదా, ఫైర్ వస్తే అలా అబ్రాడ్ కంట్రీస్ లో ఇది కూడా పెడుతున్నారు, రెడ్ బాక్స్ లో. ఇది డమ్మీ రెడ్ బాక్స్ లో ఇలా ఉంటుంది. అది పోయి తెచ్చేసి అటాచ్ చేయాలి. ఇక్కడ ఎలా చెప్తుందో మిషన్ ఆన్ చేయగానే చెప్తుంది అనమాట, ఇది రైట్ సైడ్ అటాచ్ చేయి, ఇది లెఫ్ట్ సైడ్ అటాచ్ చేయి, రైట్ సైడ్ రైట్ కాలర్, రైట్ క్లాంపిల్ కింద అటాచ్ చేయి, ఇది లెఫ్ట్ క్లాంపిల్ కింద అటాచ్ చేయి, అన్ని చెప్తా ఉంటుంది, ప్రాంప్ట్ చేస్తూ ఉంటుంది. దాని ప్రకారం మనం అటాచ్ చేసుకుంటా పోయినాక ఇక్కడ షాక్ అనే ఒక బటన్ ఉంది, అది చెప్తుంది అన్నమాట. షాక్ అన్నప్పుడు మనం షాక్ బటన్ నొక్కితే ఒక్కొక్కసారి రిథమ్ డిస్టర్బెన్స్ ఉంటే బతికే అవకాశం. చెస్ట్ కంప్రెషనే కాదు, ఏదైనా అబ్నార్మల్ రిథమ్స్ ఉంటాయి, అబ్నార్మల్ రిథమ్స్ BDBF అంటారు. ఓకే, అవి కొంచెం మెడికల్ టర్మ్స్. ఓకే, అబ్నార్మల్ రిథమ్ ఏమన్నా ఉంటే ఇది పెట్టగానే అటాచ్ చేసుకుంటూ, ఒకవేళ ఈ మిషన్ ఆ అబ్నార్మల్ రిథమ్ డిటెక్ట్ చేస్తే షాక్ అని అరుస్తుంది. అరవగానే మనం ఇక్కడ ఈ బటన్, రెడ్ బటన్, అది అటాచ్ చేస్తాం. ఒకసారి పక్కన అప్పుడు మనిషి ఒకసారి. ఏఈడి ఇప్పుడు లేవు, మన నెల్లూరులో లేవు మాల్స్ అంతా. చెన్నైలో కొన్ని మాల్స్, పెద్ద టైడల్ పార్క్ అట్లాంటి వాటిలో పెద్ద మాల్స్ ఉన్నాయి. ఓకే, ఎక్కడ ఉంటాయి? ఫైర్ ఎక్స్టింగ్విషర్. ఎప్పుడైనా ఎయిర్పోర్ట్కి వెళ్తే చూడండి, చెన్నై ఎయిర్పోర్ట్కి వెళ్తే రెడ్ బాక్స్ లో ఉంటుంది ఏఈడి, ఆటోమేటెడ్ ఎక్స్టర్నల్ డిఫిబ్రిలేటర్. అంటే షాక్ ఇచ్చేది. మనం కంప్రెషన్స్ చేస్తున్నాం కదా, హార్ట్ ఆగిపోయినప్పుడు కంప్రెషన్స్ ఒకటి, షాక్ ఒకటి, ఇంజెక్షన్స్ ఎవరి వాళ్ళే మేము రావాలి కదా. ఈ షాక్ పబ్లిక్ CPR లో కొన్ని చోట్ల ఇది కూడా ఉంటుంది, ఆటోమేటిక్ ఏఈడి మిషన్. ఎక్కడ ఉంటుంది? ఫైర్ ఎక్స్టింగ్విషర్ దగ్గర ఉంటుంది.
Apply pads to child's back and chest as shown in the pictures. Remove packet and apply pads onto child's bare skin. Apply pads to child's back and chest as shown in the pictures. Remove packet and apply pads onto child's bare skin.
Pads.
Back and chest as shown in the pictures.
Pediatrics. చిన్న పిల్లలకైతే ముందు ఒకటి, వెనక ఒకటి పెట్టాలి.
Apply pads onto child's bare skin.
చూపిస్తుంది అడల్ట్ అయితే
Pads to child's back and chest as shown in the pictures.
8 years కన్నా తక్కువ ఉంటే చైల్డ్ అంటది.
Remove packet
ఓకే,
and apply
8 years
pads.
తర్వాత అంతా అడల్ట్ లానే. మనకి మామూలుగా 21 అంటారు కదా, 18, 21 తర్వాత. ఈ CPR లో ఏంటంటే 8 years పైన ఉంటే అడల్ట్ అంటారు. కాఫింగ్ ఉంది, మూవింగ్ ఉంది, ఓపెనింగ్ ఐస్ ఉంది, టాకింగ్ ఫ్రీ ఉంటే వాళ్ళు బతికినట్టే. వాళ్ళకి CPR చేయకూడదు. ఎవరికైతే బ్రీతింగ్ లేదు, ఎవరికైతే కాఫింగ్ లేదు, ఎవరికైతే మూమెంట్ లేదు, ఎవరైతే కళ్ళు తెరవట్లేదు, ఎవరైతే మాట్లాడట్లేదో వాళ్ళనే సైన్స్ ఆఫ్ లైఫ్ లేదు అంటారు. ఓకే
Sir, while doing CPR, if I hear a click sound like a rib breaks or something,
should do. No problem. But try to avoid breaking ribs.
While doing CPR, if the patient wakes up and he says that he has chest pain, then
No, ఆపేయాలి, చేయకూడదు. మాట్లాడుతున్నాడు కదా, is able to talk, then you should not do it. Once you started CPR like this, suddenly it tells, hey, నాకు నొప్పిగా ఉందంటే ఆగిపోవాలి.
not like this.
ఇంటర్నల్ చెస్ట్ పెయిన్ మనకేడ తెలుస్తుంది? ఫ్రాక్చర్ అయినా పర్వాలేదు, ఆ మూమెంట్ లో లైఫ్ సేవింగ్ ఇంపార్టెంట్. ఓకే, అందుకే రిబ్బు పగలకూడదనే మనము సెంటర్ లో చేయమంటాం. సెంటర్ ఆఫ్ ది చెస్ట్ కిందే కరెక్ట్ గా హార్ట్, రిబ్స్ దగ్గర కాదు, ఇట్లా ఉంటుంది హార్ట్. ఓకే, మాట్లాడుతున్నాడు అంటే వాడికి సిపిఆర్ చేయకూడదు. కళ్ళు తెరిచి చూస్తున్నాడంటే సిపిఆర్ చేయకూడదు. ఓకే, దగ్గుతున్నాడంటే సిపిఆర్ చేయకూడదు. ఏమీ చేయకుండా పడిపోయిన వాడికి
If you do more than that, CPR will do more than sir.
20 minutes, more than 20 minutes.
120 more than sir.
మోర్ దెన్ 120 చేస్తే హార్ట్ ఫిల్లింగ్ టైం ఉండదు. అంటే మనము హార్ట్ నుంచి పంప్ చేయాలి కదా, బ్లడ్ పంప్ చేయాలంటే కొంచెం రిలాక్స్ అవ్వాలి. నువ్వు ఊరికే ఇటు కొట్టుకుంటా ఉంటే ఎప్పుడు రిలాక్స్ అయ్యి ఎప్పుడు ఫిల్ అవుతుంది. సో దర్ ఇస్ నో ఫిల్లింగ్ టైం. సో యూ హావ్ టు అలో సమ్ ఫిల్లింగ్ టైం. దట్స్ వై వి టెల్ 100 to 120.